Yep.
Awesome, awesome. All right, we already did the icebreaker. We've already done our introductions. We can see our lovely snapshots, our photos. So I think you all know what we are and what we do, but our core value at Families Together is nothing about us without us. For over 20 years, we've been the training and credentialing body of New York for family peer advocates and youth peer advocates. We're peers helping peers in a variety of systems and settings. We're a network of families and young people across New York State, chapters across regions and staff. And our policy department mobilizes our network, which is all of you and many more, to bring lived experience to campaigns and systems change efforts that impact families and young people at every level of government. We believe in parents and young people are more than just their stories, they are leaders. And we try to bring lived expertise to transform systems through peer-led advocacy training, family and youth advisory councils, grassroots outreach, storytelling and media advocacy, legislative development, where we literally help write bills and develop policy focus. And we are always trying to evaluate and continuously improve our own advocacy program as well as the systems that we rely on. So let's get into the budget side a little bit. And one thing we want you to understand is that this really is a year-round process. You know, we mentioned this a little bit earlier, that legislative session itself, when the bell rings in January, that legislative session has begun. That's usually the governor's, really kicks off with the governor's state of the state. That's in January, and then legislative session ends in June. But there's actually a whole lot of other things going on, and really you can think of it as a whole calendar or cycle. So April 1st is when the executive budget is due. October through December is a period of time where we can actually influence the state budget in terms of what the governor and the state agencies are proposing as priorities. So that budget might come out January 21st, but there's actually this huge period of time where we can influence what the state agencies suggest to the governor and what the governor ultimately decides to include in her executive budget proposal. Now we're in January, January and February. This part of session, of course, already mentioned, governor releases her executive budget proposal. That's what we're going to talk about a little bit today. And then it's up to the advocates to respond, talk about what we like, what we don't like, for the legislature to respond and to hear from advocates and to hear from citizens. And we'll do that a little bit during budget hearings. And Paige actually just testified at one yesterday, so that footage is out there. And I can share our testimony a little bit later for folks to take a look at. March is the final push that month. Sometime in early to mid-March, you're going to expect what they call the one-house budgets, which is the Senate and the Assembly. They make their own version of their budgets. They say, okay, we see you, Governor, and what you propose. We're going to match it. We're going to make these changes. Here's what we like to see. And then from that point on, it's just pure negotiation between those, they used to call it the three men in the room. Now it's Carl Heastie, Kathy Hochul, and Andrea Stewart-Cousins in the Senate. And so they are the leaders that are negotiating it. And part of our job is to try to work with our legislative champions and encourage them, urge them, demand from them changes and things and specific items that we want to see them adopt, and try to convince their leadership to prioritize during negotiation. And then on April 1st, that part of session's over, and we move on to talking about policy change during the sort of April to June part of sessions, all about legislation and bills. I'm going to give Karen a moment if there's anything you want to add to this, and folks, just a reminder, Karen is Families Together's lobbyist, so she really helps guide us through this process, and there's so much more detail that we could get into here. But Karen, is there anything that I missed that you want to highlight for the folks?
No, I think you did a good summary of the what the year looks like and the in between. You know, right now where we are with both houses is, as Brad said, not only responding to what is or isn't in the governor's executive budget proposal, but really trying to make a push beyond the hearing stages, the budget hearings, but also working with both houses of the legislature to try to influence what they put in their one house budget bills, which we'll talk about more in a minute. That are basically, you know, their response, their collective response to what is or isn't in the executive budget proposal and what they've been hearing from advocates like us. So we do this through a number of ways. First and foremost, through budget letters. This is my least favorite time of the season, where we craft for the legislators budget letters that they carry and circulate to their colleagues, and then we run around and try to help get them traction on their initiative, additional signatures, sign-ons from their colleagues, and those will eventually make their way to the respective speaker and majority leader of their houses. So that's exactly where we are right now. We have several budget letters that Families Together has been leading or co-leading the charge on, ranging in topic areas from juvenile justice to mental health and insurance coverage.
Thanks, Karen.
Mm-hmm.
So, and I will invite Karen to talk a little bit about the landscape. So, but there's a few things that are worth noting, like what's different, what's the context this year, and tax receipts. First of all, we've been in a situation where tax receipts were lower than we were expecting. That's not true this year. There's actually a lot more than anticipated revenue for New York State, and that will help explain why she ended up proposing some newer investments, more than might have expected. There's, of course, uncertainty around how the new federal administration is going to impact states, like especially big states that are under Democratic control, like New York State. We're going to be keeping a close watch on things like Medicaid, and other initiatives that will impact the state budgets. Even if Medicaid's doesn't end up getting cuts, which seems likely, there has to be money for tax cuts for billionaires somewhere. But even if there's whatever they can do to sort of hurt New York State's ability to collect tax revenue or pay for things, could have some impact on the overall climate. And if we're asking for things that are, say, expensive, for instance, our $195 million rate increase proposal for CFTSS, home and community-based services, and the outpatient youth mental health system, those it might be a harder sell if the governor is thinking about potential cuts coming from the federal government, which then impacts the state's ability to pay for these things. Another thing, and this isn't exactly an election year, but certainly the governor is thinking about the elections, that even though that's in 2026. And we're expecting, of course, U.S. House seats up. So we're looking at midterms, and then state Senate and state House. So those things will be on their mind, and I think they'll be trying to make sure they have a really strong record showing that they're fighting for families, for New York voters. Karen, anything I left out on landscape that you think is important?
I don't think so. I mean, I think you covered it well. We're certainly going to be bracing for changes from the federal government, as you noted. Last week, the Trump administration really shook up our universe, right? So even though we're here in the state working on state policies, the fact that he released a memo citing federal freezing of dollars, it had reverberations through our own state house, and a lot of conversation on the ground at the Capitol these days about what more is to come. Is the stay that the judge granted going to hold, or are we going to have our budget process thrown into utter chaos and turmoil?
Hmm.
So.
Yeah, more questions than answers, I'm sure. And I know that was voiced earlier, but we're with you. And we're watching the situation closely. So this is a reminder, just for the context of New York State. In her 2024 State of the State, Governor Hochul said this quote: "For decades, our mental health system was deprioritized and funded. Make no mistake, this is a defining challenge of our time." It is our task, in my opinion, to make sure she follows through with this, that she continues to prioritize the needs of a system that's really has for decades been overlooked. And in many ways, if you look at things like the COLA, those were, if you don't adjust for inflation, those are cuts. And that's exactly what happened to our system, which has been over time slowly cut via inflation and lack of COLA increases to the tunes of hundreds and hundreds of millions of dollars, which of course can help explain a lot of the things that families talk about when they say wait lists, when they talk about job vacancies and turnover, a lot of the start and stop that goes with getting services. And the declining quality in some cases that these agencies and these different programs have. And so all those things, we agree strongly with this quote, and we want to see those things corrected. So I'm gonna go over what we see in the governor's budget proposal, and there is a report that Spencer Consulting, Karen's group, put together that is wildly comprehensive and has far more detail than what we have here, but I want to highlight some things that feel interesting or relevant to our network. These things a little less so, but also important. Some issues like universal free school breakfast and lunch, that actually was a very, very high priority of Families Together as part of the New York Can End Child Poverty and Healthy School Meals for All campaigns. This is finishing up what was sort of an incomplete piece from last year's budget, and now is making sure that all schools can have universal free school breakfast and lunch available to students, which is incredibly important for things like social determinants of health. It also means savings for families for their grocery bill, and we think it's a good proposal, and the governor does too. So she put it in her budget. There's things like enhanced state tax credits. That's going to, in some cases, double the amount of tax credits that families get. It also eliminates phase-ins that were in existence for some of our lowest income families, where they weren't able to get the full tax credit, and now going to be able to. There was a proposal for a middle class tax cut for joint filers making $320,000 or less. So you can see some emphasis from her to help support families. Of course, the same thing, the one-time inflation refund. These things, and then the birth allowance for beginning year. So some money for folks that are already on public assistance, new parents or pregnant parents and parents afterward to get a lump sum of $1,200 once they have their child. These are all things that I think are worth pointing because the governor is starting to see that concrete economic supports for families is a key part of their well-being. And that's a case that we've been making for some time as a field, as a network, that people's social determinants of health aren't just things to be aware of, but to actually help alleviate, and that in itself supports people's mental health as well. So trying to make those things, draw connections between those things, and we're seeing that in some of these proposals. Some pieces around behavioral health, way more traditionally connected to our advocacy. And you can see some things here like the targeted inflation reduction for human services. So targeted inflation reduction, new word, but essentially is the same legislation of the cost of living adjustment, COLA, that we've been fighting for successfully for the past 3 years. And obviously that seems low, right? 2.1, we're calling for 7.8%, which actually makes up the difference that the COLAs didn't address in the past 3 years. So 2.1 doesn't even address this year's inflation, which came in at 2.9% inflation. So this is too low. lower than we asked for, lower than what the actual inflation was, and we expect this. We're going to be pushing for the Senate and the Assembly to push for those things. But there's also some bright spots too. Things like the 10 million for clubhouses and specifically 4 new youth safe spaces across the state. We did ask where they expect those to go. Apparently, there's going to be an RFP coming out soon for a first round, and then this 4 in this budget will be new ones. So not sure like what that means for the layout. I think it'll depend on where the previous ones end up, and then they'll try to fill gaps. More questions than answers on that, but supporting youth safe spaces is, I think, an important thing I know our young people want. There's an additional investment for teen mental health first aid training. There's a new piece here that's a 1 million to create comprehensive clinical assessment hubs for children with complex needs. We asked questions at the state at a budget briefing with the Office of Mental Health. This is looking like they're going to be sending money in RFPs to agencies and clinics that are sort of doing this already, but maybe act in a more regional manner. That's what I heard on the call. And so certainly we know people need help getting assessments quicker and sooner so they can get the appropriate services they need. We hear that all the time. That's a big part of the waitlist equation. So that's good, I think. 2 million to support community determined wellness in historically marginalized communities. This is, we think, a good thing. It really centers equity. It's trying to make sure that, you know, neighborhoods that are struggling, neighborhoods that traditionally don't have a lot of enrichment activities and things to do, the state of the neighborhoods, block to block, that there's exciting, enriching activities, that there's green spaces and things that the community actually determines they want, and then the state funds it. So if that is what their OMH is promising to do, that's pretty aligned with a lot of the other initiatives that we have. So I think we're cool with that. There's some other pieces like smoothing access to Medicaid for justice-involved youth. So if they're already eligible for Medicaid, for instance, or CHIP, they would remain enrolled when they enter in the justice system and afterward, which helps them connect with home-based community services, case management, and things like that. We think that's a good thing. It's a simple change. They're frankly just implementing a federal policy change that came through. There's more money for enforcing network adequacy standards and parity compliance, which we know is important. There's some disappointing things here, like managed care organization tax, which is a strange thing that probably won't last very long. They're very upfront about that, but essentially allows the state to tax managed care organizations. Those are the folks managing the nonprofits and for-profit agencies that manage Medicaid. It taxes them and then recycles that and are able to draw more money from the federal government. They're expecting for this year to be able to draw down $1.4 billion from Medicaid for new services or to pay for gaps in services. And they left out mental health. And we've made the point, we don't understand why. Their answer was these are for long-standing gaps in Medicaid that they want to pay for, and they expect it to be just one-time things. So that, you know, we were feeling like this could help pay for new programs, like, for instance, our 195 million ask, but maybe that's not the case, and we don't want to add it if it's just a one-time investment. And of course, the governor has put a lot of money out for expansion of forensic inpatient units, trying to expand the hospital and inpatient system, and also more money around AOT, assisted outpatient treatment, some adjustments that she proposed to Kendra's law and involuntary placements, as well as balancing that with more voluntary street team based programming. So there's a mixed bag there, and I'm sure you guys are following what the Alliance, for instance, was formerly in the APRS, has been talking about. We signed on to a letter opposing the expansion of involuntary placements, but also thanking them and encouraging them to invest more in voluntary and community-based programming. And I'll pause there for questions. And if I missed anything, Paige and Karen, feel free to jump in. Can't see your faces. Are you on mute, or are you saying all good? Okay. So that's what's in. Now let's talk about what's not in. And we've alluded to this a little bit. Here are the things that we were pushing for during the pre-budget, before the executive budget proposal came out during the fall. We were asking for an expansion, $5.5 million to the state aid to localities part grants that family and youth peer support programs get across the state. That's a general non-Medicaid, non-CHIP funding. And that hasn't been increased in a long time. Aside from some adjustments to the COLA, we're asking for $5.5 million. Thank you to many organizations who signed on to a letter. We'll be continuing to up that and actually direct our focus now to the Senate and the Assembly soon. We also want to see peer rates in all settings increased, not just those working for clinical operations. Many of you know there was a 150% rate increase for in-home services or peer services if they work for a clinic. So great, glad you're recognizing that the rates for peers weren't high enough for family peer support, youth peer support, but that should actually be applied to all settings. And we're continuing to make that case to OMH. Here's a new thing. Not new to our network as a need, but we finally have some momentum around this from the advocacy community. We're trying to make commercial insurers make the same broad range of services that are available to children under Medicaid available under commercial insurance. In other words, family peer support, youth peer support that are offered under Medicaid and CHIP now and CFCSS, home and community-based services, those services are not available if you have commercial coverage. If you have a private insurance plan, you can't access those things, even though your tax dollars help pay for those things. And those are probably one of the bigger providers of children's mental health services in your community. Those you can't access them because the insurance companies don't cover it, and there's no requirement that they do. So this change that we're proposing, along with other advocacy groups, provider associations, would say no more. Doesn't matter if you're on Medicaid, it doesn't matter if you're on CHIP, doesn't matter if you have private insurance, you can still access all the same services. And that would be a big game changer for our system, for our field, for family and youth peer support. It doesn't cost the state anything to do it. And so we remain optimistic that that's something we might be able to get through this year. Another piece is our ask, mentioned a few times now, $195 million for children's rates for community-based CFTSS, HCBS, and clinics that serve children. CFTSS, of course, is Medicaid billable service for family and youth peer support. And those rates are too low. And in fact, if they made this investment, we could actually serve 26,000 additional young people. We could hire 1,300 new professionals to work in that field. And that would go a long way to alleviate these long wait lists that we know families are experiencing. Another piece is we want to see a 7.8% increase. We've already mentioned this for the COLA. And of course, the governor fell short on that. One last piece, and this is important because for a number of reasons, but especially funding. We have to find money to help pay for these things. Of course, we support tax increases that don't impact, that maybe are directed towards business or some of our wealthier places like Wall Street and exchanges, that we're okay with tax revenues as long as we can make these investments. But there's another place that we can save money that's actually dedicated to behavioral health already. And that's on the contracts for Medicaid managed care. So these essentially for-profit organizations that are hired by the state, contracted by the state to manage the Medicaid benefits for all of New York State Medicaid recipients. We're proposing they carve behavioral health, so mental health and addiction, out of those contracts. There's a 11% profit motive built into those contracts that they're allowed to take right off the top of the big premium payments the state gives to those contracts. That's $400 million that the state could save and invest back into the system. For that reason alone, it's worth doing, but also know from families we've talked to, from providers, that they have a huge incentive to seek profits from their contracts, and that means denying payments to providers, denying claims, delaying payments, and also trying to fight in court for payments and things that they ought to be paying for. And there's proof that they are falling short on how much they're supposed to be spending on behavioral health. And for all those reasons, in addition to that $400 million, we just think that behavioral health just shouldn't be in managed care, that should go back to fee-for-service, back to state control. So I'll pause there. I know that's a lot. Folks have questions.
Well, Brad, I'd like to do just a quick touch base on what we are doing on the ground on all of these issues. I'll let you take a breath for a second. So, and I've been at the Capitol so much, and I know you've been going 100 miles an hour too, as his page. So some of this might even be new to you. So we've been really trying to encourage the chairs to add the 5.5 million in increased state aid for family care and youth support. The chair of the Mental Health Committee in the Senate staff did share with me yesterday that they do intend to include it in their budget letter, their own budget letter to the chair of the to the majority leader in the Senate as one of her priorities. With regard to the commercial insurance initiative, we have two tracks going here. We have a budget strategy and a legislative strategy. So legislatively, I met with the insurance chair yesterday afternoon and tell me that they are moments away from having an index number for a bill to achieve this. They expect that it'll hit at any moment. And I just heard before we got on this call today that Senator Hinchey, and coming from the Hudson Valley region, has agreed to carry the bill on the Senate side. On the budget side, we've been making the rounds all week to talk to members about including this pertinent members, so the chairs of health. I just had a meeting before this meeting with the chair of the Health Committee in the Senate. So chairs of the health in both sides, substance use, mental health, and insurance. And so I've been able this week to meet with all of the Senate chairs and two of the Assembly chairs to ask that they include this as a priority in their budget letters to their respective leaders. The 7.8%, we're working in concert with a lot of our colleague organizations and kind of blanketing the both houses. Every single time I mention this, every single member is already very aware. So the messaging has been really tight on this. The carve out for behavioral health care, we are suggesting also that the pertinent chairs include this. We were working with one of our partner organizations just this morning on a letter that will go to the same four chairs that we will carry around and ask if they will include as a priority. I can tell you I've done a lot of meetings on the carve out as well in the last few weeks, and every staffer and legislator is, any of the new ones are absolutely blown away by the fact that not one of the 14 plans has been in compliance, that there's been over 200 citations lobbed against these health plans. They're not really managing the care, and they're costing the state a lot of money. So, so that's where we are.
Awesome. Thanks, Karen. So barring any questions, we'll move forward. And this will be a little bit rapid fire. So there's some other, that was just focused on our behavioral health priorities. We're of course working on a huge multi-tiered platform. One thing we've mentioned before, and we're a key organization helping move this forward and developing this, is the Child and Family Wellbeing Fund, which is targeting 10 communities with the highest incidence of child welfare involvement, higher levels of child poverty, and racial disparities. It is seeking to create a community-driven, participatory grant-making process where community members most impacted zip codes, people living in zip codes most impacted those issues, have a lot of control over how the state spends their money and invests more intentionally in grassroots, voluntary groups, smaller nonprofits, not your typical big human service provider agencies, to help build up, more social fabric in the community, more community connection, and really unlock the power of neighborhoods. That's the whole idea around the Child and Family Wellbeing Fund, really investing in those existing assets in the community. And so 30 million for that. We're going to be introducing that very soon. We have legislation, and it's included in a new act that's been put out by the Child and Family Committee in the Senate and the Assembly. It's called the Child and Family Reinvestment Act, and it is a huge, huge proposal that outlines all sorts of different things around spanning from like childcare to after school. But at the very top of that list is the Child and Family Wellbeing Fund, which we think is a pretty big deal. So we'll let you know how that goes. The fight is going to get that to be getting that into the One House. And we have a separate budget bill specific to that will be going out to chairs. The other piece, and you all remember, many of you, our staff and board, when we had our retreat in the fall, at the same time, we were rallying at the Capitol, outside Capitol, for child poverty and trying to end it. Big development, the end of the year, last year, the Child Poverty Reduction Advisory Council issued their recommendations. And their recommendations even exceeded some of the existing policy proposals that the coalition were fighting for around things like income, so expanding value of the state child tax credit, additional housing assistance available for families, raising public assistance levels that really help families access more funds, and expanding SNAP. So those details, we're going to be making out a more detailed explanation of all of those different pieces, but this comes back to what I said earlier around investing in social determinants of health as essentially a mental health and well-being strategy. That we're trying actively to make the case that people's most basic needs, families' most basic needs, are really need to be addressed in order to really unlock and support people's mental well-being. So we're seeing this happen, and we're excited to see it. Other pieces that relate to that, like high quality, free, equitable, and universal childcare system. Unfortunately, we did not see what they're called the Empire State Campaign for Childcare is calling for, which is a permanent workforce fund, which will help childcare workers who are some of the most low paid workers in the state, but it's absolutely essential to our economy and certainly people being able to join the workforce. They did not invest, the state did not invest permanently into the creation of that fund, and that's one thing we're going to want to see. We also did not see a new program called Baby Bucks, which would be a pilot program to support new parents. So the last 3 months of a parent's pregnancy and the 18 months afterward, they would get monthly installments of cash to help support and raise their child and pay for whatever expenses which come up, which as a network we know full well. Many parents know just how expensive it is raising children. Think back to things like, oh, let's talk about 0 to 3. Let's talk about the first few years of a child's life. This is directly investing in those children early on, and we think it's a good idea. And so do our coalition members. What's missing around education? More investment in family and youth peer support in those school systems. We're making that case. We also want to see the passage of the Solutions Not Suspensions Act, which would, would seriously curtail the ability of schools to suspend kids for long periods of time. New York State allows people to be suspended for 180 days. The age of people, pre-K to third grade, it would curtail how the options that schools have to suspend young people at that age. And it would also try to cut down on the types of violations that tend to be most ripe for implicit bias, things like insubordination, tardiness, truancy. You can be suspended for dress code violations. These are kind of things, these sort of like really broad and nebulous violations that are most often used for young people of color, poor students, students with disabilities, who are all those groups most disproportionately impacted by suspensions. And so we're, of course, pushing for that bill. We're also standing with the Black, Hispanic, Asian, and Puerto Rican Legislative Caucus to actually add funding to support the implementation of that through professional development of educators. We want to help grow community schools and help them expand. Community schools connect nonprofit resources, community members, parents, and families to really be a part of a sort of web of services and supports that help students thrive. And related to that, we want to see after-school programs in a more universal way. Every school should have access to a rich array of different types of after-school and summer programming. And we stand with the Community Schools Coalition, asking for some investments in that. Last few pieces here around youth justice and child welfare. We, of course, are huge proponents and some of the original members of the Raise the Age campaign, but our work is not done. We want to see an investment in the Youth Justice Innovation Fund, which is essentially trying to capture some of that funding that for Raise the Age implementation that has gone unspent for years. At this point, well over $1 billion have not been spent by counties to implement it. And so we're saying, let's create a new fund out of that old funding that would allow for community members to apply, community organizations rather, to apply directly to the state to bring up whatever services they think are needed to serve young people and help them get their life on track. Karen, I know you've been doing some work on the Innovation Fund.
Well, yes, you could say that. So starting with, we worked for the last 6 months with the Politico journalists to out the fact that the state is not spending these dollars that have been promised to raise the age and promised as really an undergirding of the services that we always said were going to be vital to the success of this program. And so that article hit at a perfect time. It hit like just before the governor released her executive budget proposal. And so it's really been part of the conversation in that zeitgeist. We have a couple of strategies here as well. So we have a piece of legislation, as is mentioned here on the screen, that would create the Youth Justice Innovation Fund, but also we have a budget strategy similar to our other strategies. This time we have sign-on letters from both of our sponsors of the legislation. They're doing budget sponsor letters. So we have been meeting with all of our identified champions and members of pertinent committees on both sides of the aisle to sign on to this initiative so that we can have it included in the conversations of the budget. Because last year we had just the legislation. It did not get, well, it did, language got in the budget. It didn't make it in the final cut, and we were unable to move just the piece of legislation because, of course, it has a fiscal. So we've been doing that work. In addition, We've been working with the Children and Families Assembly chair and the chair of the caucus. They have recently put out another letter that is aimed at the Office of Children and Family Services, and they are requesting sign-ons before it goes over to OCFS, asking for a full report and audit of funds that have been spent, funds that have not been spent, more to the point, and why, and what their solution and specific time frame is for coming into compliance with expending and spending those funds every year. So we're helping to rally some support around that as well.
Thanks, Karen.
Yeah.
I sometimes lose track of just how much work we're doing here to move this.
That's why I'm tired.
Move some of these items forward. So wrapping some things up, of course, we want to see family advocates and youth peer advocates and the child welfare system. This is less in the budget, more something we're working with the Office of Children and Families Services, the state agency that oversees child welfare in New York State, trying to get them on board, trying to help them encourage counties, and of course, trying to identify funding streams, much like O of H has done for family and youth peer support. We want to see the same thing happen in the child welfare system. We also are pushing for the child welfare housing subsidy to increase eligibility for former foster youth up to age 24 and to index that housing subsidy to inflation moving forward so that we don't have to fight for this another 20 years from now. And just to jog your memories, that subsidy we successfully advocated for a year or two ago, 2 years ago, to essentially have it doubled. It was like $350. We got it up to $725, which is going to make a big difference. That's applicable not just to foster youth, but also families that are enrolled in prevention services. But a lot of states aren't taking it up, and that's another sort of implementation thing that we're going to be talking about with the Office of Children and Families soon. We want to see parental legal representation expanded. That the attorneys for parent groups are asking for $50 million to boost that. That would improve timely services so they can get touch base with attorney before their actual case day, which is often how it plays out. It also expands what I call sort of like wraparound for parents going through a legal proceeding in the family court system. It's called they call it interdisciplinary parental legal representation. What it really means, though, is that a parent advocate and a social worker work under the auspices of an attorney together to support a family, and it has some really amazing outcomes. It's I think a pretty good standard for what support for families going through the system through a legal process could look like. And so all that money would be used for that. And then, of course, we continue our support for the FISE program, Foster Youth College Success Initiative, which supports young people who are in foster care, attend and graduate college. So, deep breaths. There was a lot of information there, a lot of good, a lot of bad. But the question now is, now what? Thank you, Karen, for answering some of those the answer to that question already. But essentially where we're at, just to get us back to this moment, the governor's made their opening move. They're digesting the executive budget proposal. Now we're pushing for the Senate and the Assembly to respond in a way that really matches what we want to see in the final enacted budget. Paige actually testified yesterday at the hearing and emphasized a great deal on family and peer support specifically. Paige, I don't know if you want to speak to what that day was like. You're still on? Okay. But we'll post the written testimony for you all to see soon. I should be able to grab that.
I think that, Brad, that communications department is going to post, and me, I don't know, Cameron's on, he can tell. I think they're going to post it today.
Awesome.
Yep.
And
That's
it's
the
only
case.
3 minutes long, right, Paige?
Yeah,
Your testimony.
yes, my testimony is 3 minutes long. We might also try give people spots in the because the thing lasted 7 hours, but there are other key points where the commissioner was asked questions that would be helpful for people. So if there are spots where we see that we want to point out, we can do that by telling you where in the 7 hours to look.
Yeah, give the timestamps if we can.
That's the word I meant.
And I'll just add that we were able to prep the mental health chairs to ask a couple of questions. So for instance, on the carve out and on the MCO tax. We were able to get it to them ahead of time so they would know what questions to ask.
It was delightful seeing what felt like talking points we said in meetings with them coming out in those questions.
It's magic.
Yeah, it's fun.
It almost sounded like our words.
Yeah, and this is really where in the we're marching now towards the Senate and the Assembly one houses, which again is their versions of the budget proposal. And so although a lot of the things that we're advocating for are not in the executive budget proposal or aren't perfect, we'll have an opportunity, and that's what we're doing now, to make sure those things are in. And we'll see where we land. Our whole goal is to influence negotiations between the governor and the legislature. And that's really where Family Empowerment Day comes in, which is going to be March 3rd. We're going to be in Albany before the one houses come out. So we're going to have an opportunity to really influence what the Senate and the Assembly decide to put into their budgets. So this that just to give you a sense of where we are in this moment and what our goals are as a network. It's obviously not just around Family Empowerment Day. Obviously, although that's a great opportunity to show up for these proposals, but you'll be seeing action alerts and letters, and emails, social media, and even issue-specific advocacy days. We'll continue to promote those things. So just keep an eye out in our newsletter and social media. There's so many ways for you and for family members and young people that you serve or work with to plug in. Speaking of which, Zach, I don't know if you want to talk a little bit about Family Empowerment Day. I'm going to switch over to our website. If I can get out of here. There we go. So,
Sure.
Zach, go for it.
Yeah. So Family Empowerment Day, it's happening March 3rd, less than a month away already. If y'all have not registered yet, first of all, what are you doing? Secondly, I'll post the link in the chat for y'all in a second, so you can go ahead and do that. Basically, we're going to take a lot of what Brad just said and, as opposed to it being on paper, we're going to now go to the Capitol and make all of our voices collectively heard and try to influence the lawmakers to put the money where their mouth is. We're going to literally go to where they work, right up to their doorstep where they cannot ignore us. Depending on where you live, we should have a bus near where you are. There's a handy-dandy interactive map right there that Brad is showcasing. The transportation is free, and we also provide meals. There's going to be meetings with lawmakers. There's going to be chants, a march, opportunities to speak if that's something you're interested in potentially as a youth or family member with lived experience. Yeah, it's going to be a real exciting time. We hope basically each and every person who is taking the time to be on this call today will be able to attend. Yeah, there's information on all of the buses on the website. Everything you're gonna need is like right there with like the registration and stuff and whatnot. And I will go ahead and post the link to that in the Brad already beat me to it. There you go. Yep, click that, and all of your questions will be answered. And as always, me and Brad are always available if you have any questions and stuff. Bring a friend, bring your family. It's going to be a great time. We hope to see you there.
Yeah, thanks, Zach. I also want to start making sure folks are aware of these sources. Obviously we want you to attend Fed. We also would love if you can talk to families and young people about some of these priorities. And there's even an opportunity to take action now. Let me make sure this is updated. Yes. So everything we've talked about has a document attached to it for the most part. And we're going to be making sure that these are available. This is the webpage. It's called Budget Priorities. We're going to be posting new information soon. But right now, what we have is all of those behavioral health priorities that you all care about. There's a letter for each one of them attached here, where we have huge amounts of sign-ons from different organizations that support these initiatives. And you can look at these closely, and there's instructions on how to take action. So you can actually send an email to these addresses. It'll link, this one's the governor, this one's Stuart Cousins' office, the Senate, and then the Speaker in the Assembly, Carl Heastie. So you can CC all of them in a customized email that you make, but there's a template here, and you can attach these letters. So you just like download it like this, and attach it like a normal email. And you can do that with all these. If you don't want to attach every single one of these, there's a PDF that actually summarizes all of these, which you can use for meetings too, if that would be useful for you. But generally just let them know where you're from, why you care about these issues, and then attach those things. So this will really be helpful for us to get, especially, obviously we already did this with the executive, but with the Senate Assembly now, with the one houses, we want to make sure they know that people actually really care about these issues. So all of that can be found here at the budget priorities piece here. You'll notice probably that I said budget behavioral health, and that's what it says right now. We're working on our policy agenda as we speak, and I actually have a draft right now that I'm very, very soon going to add to the website. So you'll be seeing this soon. But this includes all the information, all the priorities that we just talked about in the 3-page document. So it's this year we decided our policy priorities piece we'll send out first is focused just on budget issues, because we know if you include our budget issues, some of our agency proposals, and the legislative bills that we're supporting, it's really long and really complicated and sort of hard to navigate. For this, it's a lot simpler. It's really like, oh, who am I meeting with? Does their committee relate to mental health? Okay, here's a section on all of our mental health priorities in really simple language. And so it's true for all these other issues. We'll be making sure that there is a huge variety of different things that materials and documents you can use. But we're going to try to make sure you're equipped with everything you need to take advocacy to your districts, to Albany, to your families, and start working with them and making sure that they're up to speed. And also be thinking for us, if you can, about yourself or young people or families that you know who have lived experience that impacts this, that's impacted by some of these priorities. There's a mother that we're working with right now. Her name's Audrey, and she lives in Western New York or Central New York. And we're talking about commercial insurance. And she talked about how her son did not have access to all these great services like peer support and youth peer support, the home and community-based side of the system, because they had private insurance. And because of that, they couldn't give services at all. Most of the agencies that served children in her region didn't do that. Didn't offer anything for commercial families because commercial isn't required to cover those things. And so she applied to the waiver, essentially the CS waiver, which allowed her to actually enroll in Medicaid services. But it took months and months where she wasn't able to access those services. It was temporary. She was only able to access those services for her son for a short period of time, even though that made a big difference for her. You know, she talked about how her son suddenly had access to peer support, skill builders, all these things that she didn't even know existed, and they were starting to make a difference. And this is unfortunately a sad story because after about a year, they were disenrolled because they were doing better. And he didn't make it. He after 3 months of trying to get services, now that they got thrown back into the commercial system, he completed suicide. And I probably should have led with a trigger warning on that. But the point is, and she'll say it, it's an unjust system. She's ready to talk about it, right? And she's ready to be vocal and to turn her pain into power and to explain why this is so important. These bullets that I just explained to you, behind every one of them are hundreds and thousands of people who are going through something right now, and many who aren't here yet, who haven't really, who this could benefit in a huge way. So what we're fighting for matters. That's the point I'm trying to make too. And what we can bring to this advocacy space as a community, as a network of people with lived experience in these systems, is the personal side, right? That these aren't just statistics. These are human beings behind these figures, behind these proposals. And if you make those change, people in power, that will make huge impacts on generations of people across New York State. And I think that's worthwhile. So that's what it means when we're asking for people to help us identify people who are impacted by these issues. If you know someone, if you just care about it, all that helps. And that's what really this program is all about. So on that note, you know, make connections with people. Please help us connect with people that have been impacted by these issues. We want to build power with you. And that's what Family Empowerment Day is about. That's what this presentation is about, really. So who's ready to fight?
Bring it.
Let's do it. Yeah. So a logistical piece, we are looking for people that are joining the buses, who can play some sort of role in sort of just supporting bus captains. And so if you're interested, if you know you're taking a bus, and I know, hey Jen, you're killing it, Miracle. But we want to make sure that you're helpful, that they have a lot of support, and you know, just asking folks, you know, who want to help support in any way, let us know, and we can connect you to the bus captains. We might actually need some bus captains too for certain stops, really more like stop captains. So if you know you're taking the New York City bus, for instance, or if you're in Buffalo, let us know, and we'll let you know what kind of help we could use. Anyway, any closing thoughts? That really wraps up the presentation. Anything folks want to say before we hop off?
Brad,
Thanks a lot, Brad, for doing this.
Yeah, exactly. That's what I was going to say. But Brad, also the other thing is I forget the term, but the changeover the state's having on the home health support through the Medicaid, they call it, it's like CPAP. Do you know what I'm talking about? It's more developmental disability system. Have we looked at any other issue where they're changing it to one central provider or
Yeah,
under?
they talked about that quite a bit in the hearing yesterday.
Yeah,
There's in the OPWDD world, they have self-direction,
right.
and in the complex health world, in the DOH has a oh, Brad's saying evaluation time. There are I can talk to you more about it, Chuck, but
Yeah, I'm just
the state is contracting with one provider to do the fiscal part of self-direction for not for OPWGD right now, but yeah, single fiscal intermediary system.
thanks.
But they, I don't think that the state has decided anything on that, and we don't have self-direction in OMH, but
Right.
there are people that have that. My son has self-direction, and if it doesn't, it's not self-direction if you don't get to decide who your FI is.
Right.
My opinion.
Yeah, I was just curious if we've taken a stance on any of that, even though it's not.
Yeah, we're for
formal.
choice, always for family and youth and people choice.
Right. Great.
From what I understand, it's not trickled down into the OPWDD system yet, but it's been talked about to be on its way. So it's something definitely to keep our ears on the ground about.
Right.
Yeah, and we're friends with the folks that are, like Michael Searider, and those guys, and they were all at the hearing yesterday and mentioning it quite a bit.
Right.
And it, we would absolutely sign on to any position that they wanted us to, as it relates to choice.
Great.
Absolutely.
And not for nothing, but when one entity has a monopoly, not only does that not allow choice, but it creates an inability for anybody to question, or switch to a different FI if they're the only game in town.
Right.
Right. Yeah, it's interesting. I mean, I don't know if you've seen the ads for it that the state's putting out. I mean,
those are from the home health,
right?
Your folks who are currently being switched over to PPL, which
Right.
is the big conglomerate.
Right. Yeah, I mean, saying that people out there are lying about it is an interesting approach.
There are lawsuits involved. I think
Yeah.
there are some providers that are suing.
Yeah. So anyway, but thanks, Brad. This is great as always. Very clear and concise.
Thanks, Chuck. Thanks, everybody. And Zach, you have your hand up. See.
Yep, I posted this in the chat, but before everyone goes, if you could please do the evaluation for this call, that helps us a lot. I posted the link as well as a handy QR code you could do on your phone if that floats your boat more. That really helps us out a lot, shows our funders all the great work we're doing,